Acute atraumatic subdural hemorrhage in a pregnant patient with preeclampsia with severe features. Intracranial hemorrhages in pregnancy are a rare complication of preeclampsia with severe features, occurring only in 0.01 to 0.05 of pregnancies. Although uncommon, they can significantly impact maternal mortality and health outcomes during pregnancy and postpartum. Main causes include rupture of aneurysms, AV malformations, and pregnancy-induced hypertension. Specifically, subdural hematomas are a rare form of intracranial hemorrhage that are rarely seen during pregnancy. Clinical features include severe headache, dizziness, stupor, and coma. Diagnosis is aided with medical imaging, with the head CT being a common method of detecting subdural hematomas. The clinical features, patient presentation, and treatment of intracranial hemorrhage will be discussed in this case report following an EVMS patient suffering from a postpartum subdural hematoma in the setting of preeclampsia with severe features. Our patient is a 38-year-old female at 35 weeks, 1-day gestation, who was admitted to Centara General for delivery of monochorionic diamniotic twins. Her pregnancy was complicated by advanced maternal age and fetal growth restriction. The patient had no significant past medical history. At admission, her physical exam was unremarkable. However, her blood pressure was elevated to 142/81, and her labs were significant for an AST of 101 and an ALT of 194. The patient was diagnosed with preeclampsia with severe features and started on magnesium prophylaxis. A low transverse C-section was performed for malpresentation of twin A. After delivery, the patient's blood pressure was 160/95, and she reported a headache to staff. She became unresponsive to sternal rub and was intubated after a stroke alert was called. A head CT showed a large subdural hematoma with a 1.2 centimeter midline shift. A decompressive hemicraniectomy was performed, which was complicated by cardiac arrest. Repeat head CT demonstrated a reaccumulation of the hemorrhage, and a second hemicraniectomy was performed, during which the patient required multiple transfusions due to hemorrhagic shock. Post-operation, the patient did not have any strength in her left lower and upper extremities. She had a fixed left pupil and was nonverbal and unable to communicate. She required a tracheostomy tube and PEG, which were placed, and her post-op course was complicated by fever. She was transferred to the HER unit for long-term recovery. Subdural hemorrhages are most often caused by trauma. In younger patients, hemorrhages are most often caused by motor vehicle accidents, while falls account for the majority of hemorrhages in older patients. Less frequently, subdural hemorrhages can be atraumatic, with AV malformations, aneurysm ruptures, and cocaine use accounting for the majority of causes. The literature includes only a few previous case reports of spontaneous intracranial hemorrhage in pregnant patients with preeclampsia. In our patient's case, we theorize that pregnancy-induced hypertension caused her subdural hemorrhage. Differential diagnoses include aneurysms, AV malformations, and seizures. Head CT and EEG were performed to evaluate for these potential causes. Head CT is an essential tool in detecting blood within the cranium that cannot be seen on a physical exam. In our patient's case, there is no sign of aneurysm or AV malformation on head CT, and EEG did not demonstrate seizure activity. In addition to deducing the etiology of the bleed, it is essential to manage the patient's pre-existing preeclamptic symptoms, as those can contribute to the prevention or development of hemorrhage. Preeclampsia treatment with blood pressure optimization and seizure prophylaxis is of great importance in preventing adverse outcomes in pregnant patients. In the case of any patient with acute subdural hemorrhage, craniotomies and decompressive craniectomies are the surgical treatments of choice, with studies showing little difference in mortality rates between both treatments. To conclude, as seen in this case report, a subdural hematoma postpartum puts patients' health at great risk. Although rare, the development of subdural hematomas during pregnancy can drastically alter patient outcomes and can result in death. It's very important for physicians to be mindful of the signs and symptoms of intracranial hemorrhages in pregnant patients diagnosed with preeclampsia.